Good morning, and thank you for joining this morning's NJ Car Clean Update webinar. We're going to talk about how all the new COVID-related developments are impacting dealerships. A lot has changed in the last few months, and we thought it was important to bring dealers up to speed on the latest information. Today's presenters are Brianna Esquilin, NJ Car Director of Workforce Development, Grayson Hannigan, NJ Car Director of Legal Affairs, and Charles Russo, NJ Car Risk Manager and Safety Specialist. They will be discussing various topics, including the updated state and federal guidelines and regulations, OSHA enforcement and investigations, how to handle former complaints, developing a written COVID protection program or policy, streamlining employee health screening, current isolation and quarantine parameters, the latest on the available COVID vaccines and who is eligible, as well as other employer responsibilities. Before we begin, just have a few housekeeping details. On the right-hand side of your screen is your control panel. Take particular note of the questions tab. During the call, all participants will be muted. If you have a question during the presentation, we ask that you write it down. We'll give you a heads up when the webinar is winding down, and you can submit your question in the questions tab if it hasn't already been answered. They're going to throw a lot of information at you over the next 30, 35 minutes, I think Brianna said it was going to take. And then we'll take all the questions at the end if your question hasn't already been answered. So now I'd like to turn things over to Brianna to kick things off. Brianna?
Good morning, everyone. Happy 1 year of living in a pandemic. I can't wait till we can share more interesting and less depressing information with you. On that note, happy Tuesday. Thank you for joining us this morning. There you have me on the call and also two of my coworkers. We have Charles. Charles, would you like to introduce yourself?
Hi, I'm Charles Russo. I handle the insurance and the zero injury program over here at NJ Car.
And we also have Grayson Hannigan, who just recently joined us at NJ Car. Grayson?
Good morning, everyone. I am newly minted Director of Legal Affairs, and it's a pleasure to be able to present for you this morning.
All right, so let's get started. Just a quick overview for anyone that missed any of our previous NJ Car Clean webinars. NJ Car Clean is a gold standard certification program created to stop the spread of infectious diseases like COVID-19 in dealerships. It's a policy and procedures manual for our members to follow while navigating a pandemic that is specifically designed with their business model in mind. A program that aims to prevent future shutdowns and or business disruptions caused by an infectious disease outbreak, and a tool that can be used to educate your employees and customers on what your dealership is doing to keep everybody safe. So what's new? Since we last spoke, we have a new administration that came in. The Biden-Harris administration made it a point that they were going to focus a lot of their effort towards the pandemic and getting us out of it. Things they're focusing on is access to free and reliable testing, fixing PPE problems, so shortages of face masks and coverings, equitable distribution of vaccines, which, as most of you probably know, as of yesterday, they announced for April 19th, anyone over the age of 16 will now be able to qualify for the vaccination. They want to focus protection towards the elderly and those at risk. They are making OSHA enforce these rules much more than the previous administration, and they are very consumer and labor focused.
Yeah, so as Brianna said, under the current administration and the unions, OSHA really kind of came under fire for not doing enough to protect the workers. There were early calls for an emergency temporary standard, for OSHA to create one and put that in place. OSHA decided not to do that. What they did is they really doubled down on the general duty clause, which essentially states that it's the employer's responsibility, if there's a known hazard in a working environment, to take steps to prevent that hazard from causing injury. They issued updated guidelines in January 2021 that talked about written and enforced COVID-19 prevention programs, hazard assessments, more discussion around personal protection equipment and employee screening, and discussions around stop the spread, health assessments, and positive cases, and of course now vaccines. They also created a national emphasis program in March of 2021, and that's primarily focused on high hazard industries, which we don't fall under, and high hazard jobs. So there might be certain jobs that are in the automotive retail industry that could be considered hazardous depending on what kind of exposure that creates. But that's essentially what they did. So what OSHA is saying now is that you should have a written prevention, COVID-19 prevention program at your workplace, that your employees should have input on that program, and that you should be doing hazard assessments. So you want to identify the controls that limit the spread of COVID-19. There's a hierarchy of controls. OSHA's big on elimination, encouraging individuals that might be infected to not come into the work environment is the best way to prevent that exposure from being in the work environment. And then they're talking about doing job safety and job hazard analysis. So let's say you're a salesperson and it might not be easy to social distance, making sure that that employee has what they need in order to protect themselves. And analyzing ways that maybe that employee could do things differently, where you could have social distancing or proper use of PPE. They are also saying that you need protocols to separate potential infected employees. Probably the best practices would be to create a separate area for those employees while you determine whether the employee is healthy enough to go and seek the care that they need, and then making sure that that employee leaves the premises safely and goes and gets the care that they need. They're re-emphasizing implementing and communicating physical distancing, barriers where physical distancing cannot be maintained. Most of you have put in barriers at service writer desks where distance can't be maintained, or at a cashier desk where people may not be able to maintain 6 feet of social distance. The other thing that they are emphasizing now is that the employer should be providing face coverings and personal protective equipment. They should also be training the employees and enforcing use. And I don't think of enforcing use as you better type of enforcement. I think that businesses that are effective at this take a more pragmatic approach rather than a political approach. I'm wearing a face mask, you're wearing a face mask, we're protecting each other. We certainly want to protect each other through this. If there's a chance that I could give somebody an infectious disease that's going to give them a serious illness, I want to wear that face mask properly. I was talking to someone the other day and they had the face mask on the chin. It's become chin jewelry, it's become neck jewelry. That's not the purpose of a face covering. A face covering, the idea is to protect your fellow worker and the customers that are coming into the environment. So wearing them properly is very important. Another area that's good news for us as we're heading into the warmer months is improved ventilation. Keeping the doors open where you can, garage doors in shop environments, so that there's good ventilation going through there. Considering, looking at ventilation systems, making sure that they're working properly, that you're doing the things needed to maintain them. All good ideas to incorporate in what you're doing, and all things that OSHA wants to see you doing. Making sure that you have supplies for good hygiene. Face masks, gloves, disinfectant, hand washing, soap, and things like that are definitely still important. So continue to have those things available for your customers' employees. And then routine cleaning and disinfecting. NJ Car Clean has checklists that you can use on our website to do that. They're very good. You can work off of them, and they'll be helpful. Communicating protections against retaliation. This is a big one. So what OSHA's, where they're coming under pressure is they want to make sure that they're communicating out there to the employer that employees need to feel safe coming to work. They need to feel that they can communicate their concerns. So if I'm working with an employee that's not taking it seriously, is coming within 6 feet of distance of me and is not wearing a mask, and I'm concerned about that, I should be able to go voice those concerns somewhere to my employer and not have any kind of retaliation that occurs against my employment with that employer. And that's really a big thing. That's a big part of their national emphasis program is that. Time off policies surrounding COVID-19, they have to be non-punitive, clearly written, and you should really provide and make sure that the employees are signing off on. And then continuing to follow CDC quarantine and return to work recommendations. I think best practices is to just continue to do that. I know there are some alternatives out there with local health departments and things like that, but my suggestion would be to continue to follow the CDC requirements. Next slide. So a comprehensive communication plan is another area where OSHA is emphasizing. So workplace coordinator, that is really a must-have. We were saying this to our members very, very early on. If you put a point person in, and I'm an employee that's concerned that Joe's not wearing his face mask and might be, exposing me to COVID-19. Again, I need a place to go. So a workplace coordinator who's going to have the understanding of what's going on, who's going to be able to take my concerns and put them into action to make sure that everybody's doing what they're supposed to be doing, is going to prevent me from going outside of the organization to complain. And that's really essentially what we want to happen for our members. We don't want to see our members have employees that are going to OSHA to complain or to the NJDOL. We'd rather have them, take care of it internally, not be retaliated against, and have somebody who takes the steps that are necessary to correct the concerns. System for communicating COVID-19 symptoms, exposures, or hazards in the workplace. You definitely need to make sure that there's, we have executive orders that require you to pre-screen before anybody comes into the before any employees come into the location. We have different tools out there that you can use. You need to put those in place and make sure that the employees know that they're in place. Make sure that there's communication around those things. Do everything possible to minimize negative impacts on employees of quarantine or isolation on employees. Again, this is an accommodation situation. You need to try to accommodate your employees as best as you can. If they can work remotely, you want to provide that accommodation. If they can't, you want to make sure the environment gives them enough space so that they're not coming into contact with infected people. Recording and reporting COVID-19 deaths and infections to OSHA is something that it's a little difficult to determine, right? So you have an employee that comes into work midday, they're not feeling well, they have symptoms. You isolate that employee. That employee works with 3 or 4 other individuals. You send that employee to get a test. The test comes back positive. At that point, you really need to do a little investigation. Did it happen at the workplace? Did it happen outside of the workplace? If you can trace it to outside of the workplace, you're probably in pretty good shape where you don't have to report it. What some businesses are doing is everybody that's come in contact with that particular employee then goes either into quarantine and gets tested and then comes back to work, and essentially they're making sure that they're documenting all this. And that's probably the best way to handle it. The flip side is we've seen some businesses where it's not taken seriously. Somebody's sick, they're not doing what's necessary, they've been exposed to other employees, they've then given COVID to other employees, we can trace it to the facility, the dealership facility. Those types of things need to be reported to OSHA. So every individual that's gotten COVID-19 from the workplace environment, and it's clear that they have, that needs to be recorded for OSHA. Now, if you have a hospitalization or death arising out of that scenario, then you have to contact OSHA. I believe it's within 24 hours and let them know what's going on. So you must ultimately follow 29 CFR 1904 when reporting COVID-19 deaths and hospitalizations, and you have to follow it for reporting purposes. We'll have all of these links on our NJ Car Clean website for you to review as well. And also, outbreaks should be reported to local and state health departments. Also, another thing is work-related cases could trigger a workman's compensation claim. For that, I would contact your insurance professional or broker for details. If you feel as though there's a work-related COVID outbreak or case, and it needs to be reported to your workers' compensation carrier, discuss it with your insurance professional. And then make sure that you're allowing employees access to vaccinations and discussing the risks associated with providing the vaccine. There are risks to you as a business to providing the vaccine or not, and that's something that you really want to discuss with your legal counsel. Next slide. So am I taking this one? Employee screening is still required by Executive Order 192.
Sorry, Charles, I was muted. I got it.
That's okay. Okay.
We're still doing employee screening in the dealership, whether it be temperature screenings or you have someone doing the questionnaire in the morning and trying to hunt down all the employees. We linked up with a company called My Health Champion, who really expedites this entire process, eliminates the need for temperature checks, paper trail. I'm going to show you just a really quick, not so much a demo, but just a slide-by-slide of what the app would look like. Keep in mind, you're still required to do them. I have a feeling the requirement for daily health checks is going to continue on even past the mask mandate, honestly. There'll be no need for masks if nobody has symptoms, right? So a little bit about My Health Champion. They're HIPAA compliant, so you don't have to worry about any kind of issues arriving with mishandling medical documents. It complies with the CDC guidelines for your required COVID screening. So the questions that they ask are changeable and are able to be edited for your dealership. However, they make sure that they comply with CDC. The app is super simple to use for your employees. They log on in the morning, they answer a few questions before they get to work, and they're cleared. There's no traffic jam at the door. There's no people coming in the building that haven't been checked yet. That's a problem. You have individuals walking in the dealership, they haven't had their temperature screened because they went in a door where there wasn't somebody there, or they haven't filled out their assessment yet, and lo and behold, they have COVID symptoms, and now they've been around the dealership. So I'm just going to show you a few screenshots. So if you were an employee and your company was signed up with My Health Champion, you would basically log on to the app, you'd get a notification that you're due to be in work today. You can also require that they fill it out on their day off. So an opening question could be, are you planning to be on site today? Have you tested positive for COVID-19? Are you caring for somebody with COVID-19, or have you come in close contact with someone? They ask about the symptoms. You can even have them report your temperature, have them take the temperature of themselves at home and then report it into this so that you can still document temperature. Again, like I said, all these questions are able to be changed and edited. Bear with me one second. Okay, here we go. So now you have one or two answers. If you're an employee and everything comes through okay, you're going to get this nice blue check. You're able to come into the building, no problems. If you answer any of the questions with an answer that is, it could show that you have symptoms or something is not right, you're going to get this red screen with an exclamation point. It's basically like a pass-fail indicator. If you fail, you're going to get a notification sent to your administrator on their dashboard for review. And then if you pass, you just get added to the list of all the employees that are good to enter for the day. So the dashboard could be a department head manager, it could be one person in the dealership, it could be multiple people. You're going to log in the morning, you're going to see that all your technicians filled it out except for Joe. You contact Joe. Joe, why didn't you fill it out? Oh, I forgot. Okay, no problem. Can you please go on and do that before you enter the building? And then you'll see here that you'll see how many people have filled it out versus haven't, who are all clear versus they have alerts that there's something wrong. And hopefully that'll come in all clear for your staff so that you don't really have any issues to deal with. Now, if you have someone come through that has an alert, you can call them and say, hey, listen, I happen to notice that you have a runny nose. Are you feeling okay? You reported some symptoms. Oh yeah, I just have allergies. I'm fine. Everything's great. All right. Well, you're allowed to come to work. Not a big deal. But now, if they say they have a fever or they lost their taste or smell, you can tell them that they need to see a doctor and get a COVID test before returning back to work. So just NJ Car Clean pricing right here, we negotiated some really good pricing for you guys. It's based on the number of users that you have. You have a one-time setup fee that is discounted to $450. They get you up and running about 5 to 7 days, depending on the amount of employees that you have. If you have multiple rooftops, you can pay one setup fee and then just pay the larger dollar amount for the amount of employees you have. So if you have 3 stores with 120 employees, you would pay $249 a month plus the one setup fee. If you're interested in learning more about My Health Champion, you can visit tinyurl.com/njcar, or you can contact me anytime. I'm always available. And then I could get you a demo, or we could even get you a free trial. I'm going to hand it over to Grayson here. He's going to go over mandatory vaccination in the workplace. This information gets a little in depth, but it's very, very important if this is something you're planning on doing. So, Grayson?
Thank you, Brianna. Good morning again, everyone. So, vaccinations are becoming the norm right now. You have some people who, may want to take it, some people who have, issues with taking it. But it's important right now for dealers to pretty much decide, do I keep the status quo with everyone deciding to go out and get the vaccine themselves, or do I want to, further protect my dealership, my employees, by instituting a mandatory vaccine program? This presentation, we don't really aim to tell you what to do in terms when it comes to that, but we do want to lay out some important information that you should take into consideration before you you mandate vaccinations for your workplace. As you know, vaccinations do not replace what you currently have to do. Right now, you're mandated to adopt a COVID policy, or you should have one, right? You also want to advise your employees of the policy, and you also wanted to sign and acknowledge that they read and they received your COVID policy. But dealers must continue to implement the following: maintain proper social distancing within your facility, require face coverings by employees and customers, and limit your occupancy in your dealership. Frequently sanitize high-touch areas of the showroom, the service waiting areas, and sanitize vehicles before and after service, test drives, and upon delivery. You have to maintain those basic things right now. Vaccines, as you know, if you're going to implement them as a condition of employment, right now you have vaccines being distributed under an EUA, an emergency use authorization. They're not final vaccine licensure by the FDC. Vaccines that are administered under an EUA must be accompanied with a fact sheet. Many of you who already have the vaccine, have gotten the vaccine, you get there, they give you a slip of paper to sign, and they hand you an envelope. Many of you may not even open the envelope, but inside that envelope is a fact sheet describing the EUA and your right to refuse the vaccine, and providing alternatives to their product. That's the difference. Again, that's also an important consideration if you decide to mandate a vaccine because they are under a emergency use authorization. So again, you have to decide whether or not you want to consider, giving the vaccine on site or require your employees to get vaccinated on their own and provide you with proof. Now, again, you could also, by requiring the vaccine, you could provide for vaccinations through a third party that you contract with. Any of those choices, as long as you are mandating the vaccine, you should know that employees, certain employees at least, have the right to request accommodations. And the two most important accommodations are individuals who, hold a sincerely held religious belief in accordance with Title VII of the Civil Rights Act. An employee must tell you that, a mandatory vaccine conflicts with their sincerely held religious beliefs. Again, this information could be firsthand explanation from the employee and maybe verified by third parties. For example, an individual could get a notarized affidavit from their pastor, something from a friend who just knows that they hold this sincerely held religious belief. Now, employees, and we'll get into this a little bit later, do not have to accommodate individuals' secular or medical beliefs about vaccines. But with all that said, the EEOC encourages employers to assume that an employee's request for religious accommodation is based on a sincerely held religious belief. No one wants to really fight this fight. Someone comes to you, the effort that it will take for you to actually or have them prove that they have a sincerely held religious belief is really a difficult one. And that's why the EEOC just encourages employees really just to assume that it is true, come from the employee. Now, if you do decide that you really want to require proof, on an objective basis, you can question whether the religious nature or the sincerity of the particular belief or practice is actually true. You are justified in seeking additional supporting information if you don't believe the employee's request is actually genuine. Employers are encouraged to use a religious accommodation request form. For example, if someone comes to you and says, listen, I have this deeply held religious belief, I can't take the vaccine, then, give them the form to fill out, and it helps to document, their request. You really don't want to pry too much. An employer that asks for necessary evidence risks liability for denying a reasonable accommodation request. And again, it goes back to the EEOC, just suggesting that employers just accept it. Now, the employer must make reasonable accommodations for employees unless doing so would result in undue hardship. Undue hardship is undue hardship, it has to be more than a minimal burden on the operation of the business. It can't be just tied to money. You can't just say, it's going to cost me extra $100 to give this accommodation, a week. It has to be something that really affects the operation of your business. And that's what the undue hardship is. Undue hardship under Title VII is actually a lower standard than undue hardship under ADA, which we're going to get to next. Just to be sure, violations of Title VII can subject you to significant damages. It's really not something that you really want to play with. So the other accommodation or exemption that's usually dealt with in terms of vaccines is whether or not an employee's disability or medical condition under the Americans with Disability Act, whether they actually have a disability and taking the vaccine will affect, or they believe it might affect that disability. Under the ADA, an employer must provide accommodations unless they would place an undue hardship on the employer or the employee poses a direct threat to the health and safety of others at the dealership. Under the ADA, employers must interact with the employees under the ADA in good faith. Now, I say interact in good faith. Some employers sometimes don't interact at all, but you want to make sure that you sit down with the employee and discuss with them, you know, what their issue is in terms of presenting their disability to you and asking for an accommodation. If you wish to speak to the employee's doctor, you definitely need a HIPAA form, a release form signed by the employee. Now, it is recommended that you use an interactive process questionnaire to be completed by the employee's physician that really asks the following questions: the nature of the employee's impairments, the duration of the need for accommodation, and the extent to which the impairments conflict with the employer's vaccination requirement. Employers must determine, though, that the accommodation poses a threat or creates an undue hardship or poses a direct threat to the health and safety of others at the dealership. Now, in dealing with the ADA accommodations, there's certain considerations that you, the dealer, you know, must take into consideration. Again, we've already talked about the undue hardship and posing a direct threat to the health and safety of others. Again, the undue hardship here under the ADA is more than any, you know, de minimis cost or burden, as mentioned before. Increased cost to the employer is not enough. It must create a substantial operational difficulty and expense to the dealership. The ADA's undue hardship, as I mentioned before, is a little complicated and it's more stringent than Title VII. And because of that, the ADA considers the individual facts of each case. Next slide. Here, there's certain, you know, common accommodations under Title VII and the ADA. According to the EEOC, if an employee cannot get vaccinated for COVID-19 because of disability or sincerely held religious belief, practice, or observance, and there is no reasonable accommodation possible, then it would be lawful for the dealership to just exclude the employee from the workplace. Even under this, though, the EEOC has given guidance that, you know, you do want to still sort of help that employee out, you know, give them, you know, is it possible that they could potentially work from home? It's difficult in a dealership. And, you know, we'll discuss other things also, is that potentially, you know, they can't remote work, social distance, you know, masking, you know, shift changes, location change. They could potentially have, you know, other leave on their FMLA. But, you know, telling somebody they can't come to the workplace is pretty difficult. You may not be able to provide the accommodation that the employee is requesting, but certainly something can usually be carved out. if you're going to mandate a vaccine, whether on property or through a third party, certainly there are pre-screening questions that are necessary, medical inquiries that are necessary before that individual gets the vaccine. If dealers mandate the vaccine at work or contract with a third party, you have to consider, the ADA's limits on medical inquiries about an employee's physical or mental impairments or health. The reason that is important is that, getting certain information from an employee can be used later on if you have to make any type of disciplinary decisions regarding an employee, and they could come back and say that, listen, you did A because you learned of this information, or you did B because you learned that, diabetes runs in my family or something like that. The vaccine under the EOC is not a medical examination. Now, we talked about, again, pre-screening questions. We really want to be careful about asking or eliciting any type of health, protected health information. Now, there are exceptions to asking certain questions, certain pre-screening questions. You pretty much can show that any questions that you're asking are job related and consistent with the business necessity. Next slide. Now, we mentioned that, again, you can show that any pre-screening questions are job related and consistent with the business necessity. The dealership must also show that it had a reasonable belief based on objective evidence that an employee who does not answer the questions and therefore does not receive the vaccination will pose a direct threat to the health or safety of her or himself or others at the dealership. Many of you may know of the Genetic Information Non-Discrimination Act. It pretty much prohibits employees from making employment decisions based on the employee's genetic information or obtaining genetic information. You want to be careful not to solicit any of that information from employees. You want to make sure that you tell them when they're filling out pre-screening questions that they should not provide any type of personal genetic lineage information. Again, it could come back to haunt you when you make disciplinary decisions regarding that employee. Now, again, dealerships can request proof that an employee has been vaccinated, just like you're requiring proof now that they, for example, that they, if they tested positive for the coronavirus, that before they return to work, they have to provide you with a negative test. Now, employees sometimes just, again, claim that, they distrust the vaccine. They believe they'll, get ill from it. Any other decision that is not a sanctioned accommodation, a sanctioned exemption from taking the vaccine, like religiously held beliefs or a disability, these objections do not constitute an exemption. But again, as the EEOC mentioned, some individuals are really concerned, but the employer should still try to, I would say, handle them with kid gloves, in a sense, just to make sure that they are comfortable in the workplace. Maybe not necessarily providing them a accommodation per se, but to try to alleviate their fears. One of the ways that you can alleviate the fears of your employees is to make sure that you have employee education. Again, before you mandate any vaccine in your workplace, you want to make sure that you have a written vaccination policy. That is definitely a must. You need it as a guide for example, the employees who decide that they do not want to take the vaccine because they distrust it. You want to have certain sanctions or procedures built into a policy that tells them, you know, this is what's going to happen, right? I am, as an employer, I am mandating the vaccine. I'm requiring you to either go out and take a test, get the vaccination and provide me proof. If you don't do that, it is a condition of your employment. And if you don't do that, what are the procedures that I, as the employer, will take to discipline you? So again, a written vaccination policy is a must. An employer can provide incentives, but they must align with and comply with the EEOC wellness rules. You can't you pretty much can't pay your employee to take the vaccine, and you don't really want to cross that line. If the dealership does sponsor the vaccine, you can give de minimis value items. For example, gift cards have been stated that by the EEOC to be okay as an item that, for example, you can just give to the employee to encourage them to take the vaccine. Training and education is important. Again, the essential requirements, discipline, termination will be in your vaccination policy. And again, I cannot emphasize more how important that is if you go down this road of mandating vaccines.
All right, everyone, we're just about 3/4 of the way there. We have a few slides left. We'll try to get through them pretty quickly because we're running a little behind on time. Basically, I field all the questions from the dealers regarding COVID isolation, COVID quarantine, when can my employees come back from work? So I always point them to the CDC because this information is changing constantly. So just to give you a quick 1,000-foot view, just so that you could kind of understand what the latest regulations are, but always check the CDC and NJ.gov for the most up-to-date information, or you can, of course, always ask me. So quarantine is what someone has to do after they've been exposed or possibly exposed to someone with COVID-19. If you've had COVID-19 within the last 3 months or fully vaccinated, you do not have to quarantine. If you're quarantining, you need to stay home for 14 days and watch for a fever and other symptoms. You want to follow recommendations from your local public health department, which there's ones for each county that you can call. If you want to expedite your quarantine, you can do 10 days without symptoms and no testing, or after day 7 of quarantining with a negative result on day 5 or later, you can come back after day 7. Isolation is what you do when you are sick or one of your employees is sick. Even if they have to isolate in their home away from their families, you want that to be at least 10 days since the symptoms first appeared or you've had a positive test. You can come back to work after 10 days with no fever for 24 hours. All your other symptoms are improving. If you've been hospitalized for a more severe case of COVID, your isolation time could be up to 20 days. And if you have a positive test with no symptoms, at least 10 days since that positive response. I want to make this very clear for everyone, as I know in our previous webinar, we suggested that you have a negative test before returning to work, but at this point, the CDC suggests not requiring a negative test. Instead, ask for a fitness for duty note from the doctor, which they are very willing to give. Positive cases, even with no symptoms, can test positive for up to 90 days. So allowing them to come back to work as long as their symptoms do not return or worsen is totally fine. Handling complaints. This is a very, very important part of this entire webinar. Some of you may have had employees or or customers complain to the New Jersey hotline regarding your COVID protocols. We have walked dealers through the complaint and the investigation. So just if you haven't been investigated yet or contacted by the DOL, I just want to give you a brief overview. So depending on the severity of the complaint they receive, they will call, they'll typically call somebody in charge of handling COVID at your dealership. So that's why it's important to appoint a point person there. The complaint will be anonymous. Typically, it's from an employee or a customer, but it could also be from a vendor or really any visitor that comes into your store. The investigator is going to ask one of the following. I would like to see your COVID-19 prevention program. What is your written policy regarding COVID-19? Do you have it signed off by your employees? What is your stop the spread protocol? So they're going to ask you for photos of barriers, social distancing posters and signs on the floor, hand washing signs, the floor markings, PPE, hand sanitizing stations. All of the above can be found within the NJ Car Clean materials. We also have a policy template that you can build off of. I've also helped several dealers through their policy writing regarding COVID-19. So again, if you have issues, please contact me. If all the above is to the satisfaction of the investigator, you're more than likely going to avoid an on-site visit. I haven't had any dealers get a visit yet because they've been very responsive with the requirements from the investigator. But after receiving a complaint, you want to make all necessary corrections and then also make sure your employees know what the changes are and the implementations so that they are satisfied and do not call again. Complaints can also be reported directly to OSHA, and depending on the severity, this can lead from anywhere from a phone call from an OSHA investigator to a full-on visit and investigation. I'm going to turn it over to Grayson, who's going to just review the employer-employee relations, and then we'll be all done. So if you have any questions, now would be a good time to submit them. Grayson?
Thank you, Brianna. Just really quick, I know that we're running out of time. I'll just highlight a couple of things here. So again, just focus on accommodations from any worker in your dealership. Again, for ADA purposes, you do have to sit down and speak to the employee. Now, with COVID, whether for a COVID test or a positive employee, or even someone who fell sick because of getting a vaccination, there have been a slew of updates under the Families First Coronavirus Response Act, which was pretty much just extended by the American Rescue Plan of 2021. Some of you know, which isn't here, but under EFMLA, if employers decide to voluntarily pay for an employee to be out for up to 12 weeks, again, a tax credit is allowed for that. And again, under the EPSL, which is the emergency paid sick leave, that initial 80 hours, 2 weeks of paid sick leave, again, is voluntary, it's not required. Under the American Rescue Plan Act of 2021, it's pretty much been extended from April 1st, 2021 to September 30th of 2021. And again, what it actually does, it resets an employee's availability to the emergency paid sick leave. For example, if an employee used EPSL prior to April 1st, they can also use it again between April 1st through September 30th. However, it is voluntary for the employer to actually pay for those 2 weeks or even pay for anything under emergency FMLA. Again, dealerships paid time off policies applies to quarantine. I mean, you cannot quarantine or self-isolation. You cannot really force an employee, however, to use their sick time versus, for example, emergency family leave for COVID reasons. And I think that's about it. Now, The employers can and cannot do. This was actually in the previous presentation that Brianna did last year. We just want to just reemphasize that the employers can permit employees to remove face masks at certain times. You can deny entry for individuals not masked. Everything that is listed here, what you can do, you can test employees for COVID-19. You can take your employee's temperature. And again, the items that I mentioned before at the beginning, you need to continue to do those things to make sure that your dealerships remain safe.
All right, last page, and we'll be all done here. Just a reminder that we have some really nice promotional materials that we created for NJ Car Clean. And any of our members that are certified, which are pretty much probably all of you on this call right now, are able to get 10% off anything that they reorder after their first free kit arrives. So just a reminder, we have the reusable car door window decals and rear view mirror hang tags. We have the large 15 by 15 entrance door decals that are also reusable and can be moved. They're window clinks. We have the breakaway car door seals, which are a real hit on new car deliveries and service vehicles going back to customers. And a favorite is the 20 by 40 foam core poster that is great for your showroom or your service waiting area, that just basically asks the customers to do their part. And every item that we have directs you to njcar.org/safety, which is a detailed page customer facing that goes over what the dealerships are doing to make sure that their employees and customers are safe. Lastly, we can review any questions. And if you want to contact us, any of us directly, you'll see our emails and direct lines below. So just thank you, and I'm so sorry we went a little over on time. Lots of information when we dive into the employer relations and vaccinations. We just want to make sure we support you guys as much as possible and keep you guys out of any hot water. So thank you again, and we'll be taking questions now.
Yes, we have a couple of questions. As I said at the beginning, there a lot of information was going to get thrown at you, thrown at everybody. When an employee has a possible close contact with another employee that has tested positive in the workplace, how long should you keep the first employee out of work if they test negative?
Well, I'll take that question. So if that would be an isolation instance because they came in close contact with somebody at the dealership that definitely tested positive. So you would do one of two things. You're going to have them quarantine and take a test on day 5. And if they're negative, they can return to work after day 7.
Okay. This one is about vaccinated employees and the travel quarantine. If an employee leaves the state of New Jersey upon returning, are they required to quarantine for 10 days? It sounds as if they're asking if somebody's been vaccinated, but I guess maybe if you can address both.
So if you're fully vaccinated, the CDC does not require you to quarantine. However, if you are not fully vaccinated and you travel, you need to quarantine for a minimum of 10 days and watch for symptoms. Okay.
And if anybody else has any other questions, feel free to enter them, but this is the last one I have up here for now. Does NJ Car have a COVID-19 workplace policy handbook? If so, how can they obtain one?
We do not. We suggest that employers write theirs on their own, obviously, because we could not, we can't make them dealer specific. However, if you have a basic policy and you'd like me to review it and make recommendations or changes or suggestions, I can absolutely do that for you and assist you with that, as I've done numerous times in the past for other dealers. So whoever asked that question, please email me and we could work on that together.
And keep in mind too, there's a lot of good information on the NJ Car Clean website. We do have a guideline which you could work off of in order to create those policies that provides a lot of detail about what you might want to put into practice.
And obviously they should, and when they're putting this together, they probably should have their attorney take a look at it to make sure it meets all the requirements.
Yeah.
A woman, somebody who asked the question about the vaccinated employees and the travel quarantine, their confusion, they said their confusion is the state of New Jersey does mandate that everyone quarantine. I guess New Jersey maybe hasn't updated the mandate to say if you've been vaccinated or if you haven't. I guess they're saying that's where the confusion is lying for them, at least.
Right. And Brian, that may actually change today, because remember we have news that potentially that the governor has changed the travel advisory, so that may change. We just actually don't know what it is yet. We're going to look into that today.
Oh, that's right. That's right. We're going to hopefully put something out today. So the woman who asked that question, you may see an email from us later this afternoon about that. I forgot about that. And I think that's it. Anything else any of the three of you want to add?
No, I'm good over here. And I just want to clarify for her also, international travel is different than domestic too. So when your employee is going somewhere, please check the location on the CDC website. If it's high risk, low risk, medium risk, very high risk, all these things have impact based on the quarantine. So if that person would like to email me directly, as soon as we get an update from the governor today, I can make sure you have the most up-to-date information as well.
Great, great. Well, thank you to Brianna, Grayson, and Charles, and thank you to all of our participants. This webinar recording and the slides that were presented will be posted to the NJCAR website later this afternoon in case you missed part of it or anyone else at your dealership was unable to join us. So that concludes today's webinar. Thank you very much and stay safe.